Well, good afternoon and welcome to this STELR Career Role Models talk for this series. We're very happy to have you here today to hear from Michelle Hall, who's going to talk about her STEM journey. And as we gather for this meeting from different places around Australia, I'd like to acknowledge the traditional custodians of the lands from which we meet. I'm joining you today from Ngunnawal and Ngambri land, and I pay respects to our elders past and present, to any Aboriginal Torres Strait Islander people who join us online today. As we share and discuss our knowledge and practices, we acknowledge the deep knowledge and understanding forever embedded in custodianship of country. My name is Camille Thompson and I am the director of the STELR program here at the Academy of Technology. And I am really excited to bring you this series of talks that we've been having all of this term, and we will be continuing to have next term. So make sure you get back on our website. A few bits of housekeeping. Today's webinar is being recorded, as you would have been notified as you came in, and will be available on our STELR YouTube channel in a couple of days' time. So if you want to go back and relive the awesomeness of this talk, you can do that online. If you have any questions for Michelle over the course of her talk, you can put it into the Q&A. So at the bottom of the window, there's a Q&A function. Put your questions in there. We'll have a look at them if we want to answer them while we're talking, but we'll definitely have a Q&A section at the end where you can ask anything you want. I'm sure Michelle's up for it. If there is also a chat function, but the one we'll be watching is the Q&A one. So if you have questions, plug in the Q&A for us. You'll also be sent a survey after the event has finished, and it would be really great if you could fill that in and give us a little bit of feedback on what works and what doesn't work, and how we're doing with these series and what you'd like to see in the future. Because as I say, we're doing it for the next year, hopefully. All our speakers are getting ready to go for that. So without any further chatting for me, the one you've come to hear from is Michelle Hall. So I will welcome Michelle to take the floor, as it were.
Thanks a million, Camille, for that introduction. Really happy to be here and to present to the team today. Now, I think we're good to go.
Definitely, it looks good.
Okay, thanks, Camille. Thanks a million. Yeah, so as Camille said, feel free to ask questions either in the chat, or if you have a burning desire, unmute yourself and ask away. I really don't mind this pretty informal session. I really took this opportunity to be quite self-indulgent, really, and tell you about my journey and sort of how I've got to the place where I find myself, and in some way hope that some of it resonates with you and maybe inspire you in some ways, or to think a little bit laterally as we go through. So my current position, on paper, I'm a senior research fellow at the Centre of Health, Exercise, Sports Medicine at the Department of Physio at the University of Melbourne. And I hold an emerging leader grant from the National Health and Medical Research Council. Now, that probably doesn't mean very much to you, but it's actually really important to me, because it's that grant that funds my salary. So the university tops it up a little bit, but that is predominantly where my salary comes from. And I'm not sure how much you're familiar with the academic system, but you can either go in sort of teaching and research, where you sort of continuum positions, whereas research-based contracts are, as I say, contracts, and that is what I hold. I hold a research contract. So that's sort of where I speak from at the moment. So what do I actually do? I like to think that I help people, or try to do, my work helps people with osteoarthritis live better. Osteoarthritis, I'm not sure if you're familiar with it, but it tends to be thought of as a condition of the joints associated with older people, although it can very much affect younger people too. And I'll give a little bit of a background how I landed on this topic. Osteoarthritis might be quite specific, but it was quite personal due to family history. So the things I do in my day-to-day work, I was going to throw up a slide off my calendar, and I was like, oh, that's a bit daunting even for me. So to think what I have to do. So I thought, I read quite a bit, and I review papers. So when journals get published, and why we publish things, we try to advance or push the frontiers of knowledge. So really what we try to do in my world is try to advise clinicians how to treat patients. And you do that through a series of studies, and they have different levels of quality or confidence in the findings. So top tier is a randomized controlled trial. If you prove something in those sort of situations in a randomized controlled trial, generally that trial will inform the clinical guideline, and then you hope that the rheumatologist or the physiotherapist or whoever's using that knowledge can use it then to inform how they treat that patient for good. Often you're very much part of a team or leading maybe some smaller teams depending on the work that you have, but you meet a lot of people, and with the wonderful world of Zoom, it's really possible to work with people from all over the world. And for example, it doesn't happen often, but tonight I've got a meeting at 12 a.m. because we had to accommodate the Americans. So that's for Osteoarthritis Research International. So we've got a finance committee, but you work in teams. And the point I wanted to make is that the world is no longer isolated in time zones. We very much work across the world, which has its good things and bad things about a career in STEM. The flexibility is amazing, but also the demands can be quite challenging. I don't know what I'm going to be like tomorrow morning. Another part of my day-to-day routine is data analysis. I really enjoy getting in and looking at the data. It's something that is sort of maybe as people progress through their careers, the research careers, they tend to be able to get data analysts in, or statisticians, biostatisticians. But at the stage I'm at, I still get to do it. And I really actually do like getting in there and seeing the data for myself, so to speak. And communication of findings is a big one too with teams. And it can be, you have to really think about who's using the information that you're generating. Is it academics, other academics? Because if it's very early on in the pipeline of research, you're going to share your research basically more with more academics so they can take it and they sort of transfer it. At some points, the research that you do is really ready for clinicians to use. Okay, so your guideline might be, or recommendation might be, okay, you guys got to get in there and do some exercise post injury within certain hours and certain exercise. So that's something for the clinicians, and then obviously for the patients as well, because that's ultimately why we do what we do and for who. So that's a little bit of background about what I do, I get to do. I say I really do actually enjoy being a STEM researcher, and so much so that I do take quite a bit of time to speak into high school students. I'm part of the BrainSTEM program, and if you're not familiar with that, I would recommend jumping online and going to brainstem.org.au. And this is where you can, with some classmates, sign up to do a 12-week research project with a mentor who is based in STEM. And this has been going since 2016. And I've done over 50 hours myself, and that's just the tip of the iceberg of all the difference that they're doing. And they really are expanding beyond Victoria. So I know they've got some schools involved from New South Wales. So if you are interested in getting some hands-on research experience, I definitely recommend that you check out the brainstem.org. But last year, what I would like to share with you as well, last year, we got BrainSTEM to team up with a bunch of biomechanists. So in this scenario, I'm called a biomechanist. So you can kind of wear different hats depending on the situation you're in, and biomechanics is part of the research that I do. I use biomechanics to answer questions, and I'll speak a little bit more. One of the primary examples is braces. I've been involved in some brace research. So a bunch of us girls from all these different universities across Australia put together a grant from the government, and we were successful. And our bid is to give 100 girls 100 stories over 100 days and create 100 stories about their experience in biomechanics related research. But biomechanics, as we say, is everywhere, and it really transcends all the disciplines of STEM. So this is an initiative I'm really excited and very, very proud to be part of. So if you on social media, keep an eye out for us. And the reason why we picked girls is no exclusion to guys at all, but girls tend to drop off what we call the leaky pipeline pretty early on. They tend to think that STEM is too hard. It's not for them. It's like a kind of a boys thing. So we're trying to really dispel some of those myths by targeting girls only. And that's, as I say, in Associated BrainSTEM, but also the Australian and New Zealand Biomechanics Association. So how did I get to do what I get to do. And I hope my journey's, I'm nowhere near finished. I think there's so much to learn, so much to do, and so much work to do to improve the lives of people. And you'll never be done. You'll never be done. But I thought I'd give you a little bit self-indulge about my journey as we went through. So I'm from a border county in Ireland. So it's a place called County Monaghan, and that's the village where I'm from. It's very, very small. People would say if you blink, you'll miss that you're actually through the village of Drum. But in 2004, it probably seemed ancient for you. I finished high school in Cavan and didn't really know what to do. I was sports mad. I loved all things sports. So I wasn't really sure. I decided I went up to Dublin to do a career fair, and I landed. There was 2 universities in Ireland that did sports science, one in Dublin and one in Limerick. But I also applied to do primary school teaching in Limerick and got accepted to it, but turned it down because it was too far away from home. And so ended up doing sports science and health in Dublin. And I was trying to reflect on some of the key things that really changed my path or influenced the direction of my path. But during my 4-year degree in Dublin, I got to do 1 month in Chicago, which I'll elaborate on probably in the next slide. But a very random that came up. It was sort of a far out family relative that was inviting some of the Irish relatives over to Chicago for a month, and I was probably the daft one to do it, but it really, really helped because, as I mentioned, I was pretty much a home girl. During my 4-year degree, I went home to the village every weekend. I never wanted to stay in the city. And until the last year, where I took a 4-month internship in Brunel in London University, over in London, and that was a phenomenal experience to get insight into what researchers actually do. And it's ironically, I was assigned to a professor who is Aussie and has returned since to Australia, and he works at Edith Cowan University, so Anthony Blazevich. So he is very interested in muscle physiology. But as I say, it was really, really good insight to get into the life of what a researcher actually does. And I was like, I saw, him doing his research. I was like, oh, this is a good life. This is interesting. It's fun. You get to meet a lot of people from all over the world and so on. So that was my first real taste of research, if you like. And as I say, it gave me insight to what the life of a researcher did, because before this, I never really knew. And that led to my honours project, and I got to do it in association with National Orthopaedic Hospital in Kappa. And there was a personal connection in that the surgeon that I was assigned to do the project with actually had done my grandfather's knee replacement. So that was sort of a nice tie. And what we were trying to do with that project was to see if the addition of neuromuscular electrical stimulation on top of exercise would patients do better following the joint replacement or not. So that was a pilot study that we did as part of my last year. And that, as I said, gave me a real taste of what research was. And I really was like, yeah, I don't exactly know what I want to do, but I like research, so I'm going to pursue that path. And as I said, I was a home girl, but after that trip to America, my advisor in Dublin was like, look, if you're happy to go, I think you should go. You should go abroad, get some experience in another country. And so I applied to do a 2-year master's degree in Iowa State University. And if you haven't heard of Iowa, don't feel too bad, because as somebody described to me, it's the armpit of America. It's literally in the middle of the state of America, probably quite overlooked. But to be honest, as I say, it suited me because I wasn't so keen on being in a big city with knowing nobody that I did. So I was really happy there. I did my 2-year master's degree in kinesiology. That's what they call it in the States. I focused on knee injuries that sort of, sorry, I have a dead leg. I focused on knee injuries that gave way to osteoarthritis later on. So I focused on ACL injuries. As part of my program there, I did a 20-hour-a-week teaching. So that sort of gave me my scholarship. And then I did something pretty random. I took a job in the plant pathology department during the summers as a research assistant. And honestly, that was probably one of the biggest highlights for me of the 2-year program, because I met people from all over the world, South America and whatnot. And yeah, ended up becoming some of the best friends I've had. And we visit each other back and forth. So that was really, really good. And I got a good insight into certain study designs with this experience here. So by that stage, I didn't really want to stay in America because you had to do class coursework with the master's degree. And I really enjoyed learning hands-on. And I knew in the UK and Ireland and Australia, you didn't need to do coursework as part of your degree. So it was pretty much all hands-on experience. So I applied to go to Glasgow in Scotland and also Melbourne. And I was lucky that the Melbourne application came off and I got a scholarship to come here, which is really fantastic because I got a chance to work with some of the best researchers in my field in the osteoarthritis and exercise. But some of the highlights that I got to enjoy during my PhD experience was I got to go to Denmark for 4 months. And that's where I met some collaborators from OSSER, and OSSER is an orthopedic brace company. And they have a very successful business in developing braces for people with knee pain and so on, but they weren't really, or still not really sure exactly the mechanisms by which the brace works. So when we say works, we mean how does it really relieve somebody's pain? So we were sort of done some recent work, brought that back to Australia, and have been doing it through the University of Melbourne as well. So that was my first insight into working with industry, and industry and academia is quite different, but industry makes it really real about why you're doing what you're doing. So that was a really, really nice experience. Then another big part of my PhD journey was actually my work at ACU. So I did a lot of teaching in research and evidence and ethics at ACU and biomechanics and different courses, and really enjoyed that teaching part of it as well. So when I finished my PhD, I really wanted to develop my skills, my analytical skills better. You know, I mentioned that I really like doing data analyses, and I felt like there's so many new techniques and there's so many different ways to do it. And if you knew how to do half of the analyses on the data that's available, who knows the questions that you could possibly answer. So I did a graduate certificate at Harvard Medical School over the year in 2016. Now, I thought I'd integrate some of this with my personal journey as well. I read recently that some of the misconceptions of academics is that, you know, they don't really have a life. they don't have time outside. They do what they do. And in particular, it was a story that was in Nature, or maybe it was in Science, I can't remember. Anyway, I was reading this, and it was a gay couple that we were applying for adoption. And they said the biggest part of the process for them to be approved to look after or to receive a child was not the fact that they were that they were gay or anything related to their arrangement, but it was the fact that both of them were academics. And what the social workers really want to be convinced of is actually had time for family and so on. So family was always really, really important. It is really important to me, and I always sort of wanted that. And over the last couple of years, that sort of all happened. So I did want to share with you that you can sort of get your education and have family as well. It doesn't have to be one or the other to work in STEM. So in 2017, we bought a first apartment, which was pretty exciting. And I also got my Sir Randall Haymanson Fellowship Award from the University of Melbourne, which is pretty significant in the fact that it gives you your salary to research something that you've proposed. So my proposal was to understand how exercise actually reduces pain. So that was a 3-year contract to do that. And that for me was like I'd won the lotto. You know, it was very, very exciting. And I also, in 2018, then I got married. So we had a great time back in Ireland, and we're looking forward to seeing folks back home. And in 2020, we welcomed our baby girl, Faith. She's not so much a baby anymore. She's a mad thing, really. She's at daycare right now. So hence I can do these things. And I also landed the NHMRC Emerging Grant. So again, that's sort of a salary contract that gives you permission to go and to research what you had proposed. And they're a big deal in the sense that if you don't have them, your job security is quite quite dubious. And I'm happy to speak about any of those things towards anybody, any questions around job security and things like that. towards the end. And we are excited. We are expecting a new baby in the new year, so that is very exciting as well. So as I just sort of wanted to reflect a little bit on the timeline, I showed you lots of high moments, but I would think don't discount the small things, because it really, one thing leads, you don't know where it's going to lead to, and you don't know what it's setting you up for the next time. As I mentioned, I was a real home bird. I went to Dublin, went home every weekend, tried to go to America for a month, and I loved it. It was really, really good. But that month gave me confidence then to take up the position in Iowa for 2 years. And of course I came home. I've been home every year since I've been away, sometimes twice, except for this pandemic. But don't discount the small stuff, and don't disregard where it can take you afterwards. I would say be open and have empathy. So be open to the ideas of the world. Try and think laterally. I try and do something at least once a week that blows your mind, or listen to something once a week that blows your mind. And there's so much good material out there that it's hard not to go wow sometimes, but you have to deliberately look for it. So I would say look for something once a week to make you go, wow, and have empathy. Empathy, I think, is so empathy in my mind is probably different definitions, but it's the ability to see the world through other people's eyes. And if you can do that, and if you can really understand and appreciate other people's view, you're going to come up with so many innovative ideas that can really transform society. And I think that's where I would encourage you to think, is to think big. Don't ever think I can't, or I don't have this and I don't have that. We all have empathy, and we can all develop it. And once you have empathy, you can do really, really big things. And lastly, I would say work out. As I said, I showed you lots of sort of high moments maybe during that timeline, but of course there's lots of moments and lots of failures, and yeah, there's just lots of that as well. There's lots of times. There's times where I don't know if I've got a job, which is real in academic and STEM careers. Unfortunately, that job security is not wonderful, but I don't really care how much talent people have. I've seen people so talented, and yeah, you need to mix that. Whatever you have, mix it with hard work, and who knows where it can take you. But before I wrap up, I do want to share the next couple of slides about what I think you, as high school students, could be thinking about towards the future. So I think this is really interesting. There's new jobs being created, and there's jobs for people to build new technologies. Then you need people to maintain them and to implement them. And of course, they're evolving all the time. But in 2022, some of these top emerging jobs are mostly related to data analysis. Okay, so AI is obviously artificial intelligence, machine learning specialist. That is huge in our field at the moment. And boy, if you got those skills, you're hot commodity right now. And then there's a list of the 10 jobs. So it's almost, when you go through your criteria, or when you go through your applications for university, some of these jobs that we had so firm, they're not going to be there anymore, like a job clerk, accounting. I'm not saying accountants are not going to be needed, but it's going to be these more lateral positions that are available. So I just think that was quite interesting. And so how do you really prepare when 85% of the jobs of 2030 haven't been created yet? So how do you prepare yourselves for a job that doesn't even exist yet? And I think that's a really legitimate question, and probably a question that you really should ponder on, as a high school student. What am I going to do for a job that I don't even know it exists yet? Well, some places I would say is you're a generation that is so prepared for change, because you've had to deal with change so much over the last 2 years in particular. So if there was ever a generation going to be ready for this, it's you guys. It's absolutely you. Some of the skills and capability for your future would be, there's a bunch here, right? There's just a bunch of different things: lateral thinking, adaptability, resilience, experimentation. Again, fail and fail well, because when you're not failing, you're not learning. So keep going. Doesn't matter. Fail and keep moving forward. Communication is massive, massive, massive right now. And that's definitely something I'm continually learning and involving in, is how to communicate better. Because it depends on who your audience is, right? Self-awareness, reflection, active learning. And if I were you, I'd sit there, I'd take a screenshot of this, and I'd pick out one or two of these that I would say, okay, I'm going to be very intentional about over the next 6 months to develop my skills in. There's so much material online, in books, that you can really pick one or two of these. Creativity, there's some fantastic books out there. Leadership, social influence. Really develop your mind on what each of these are over the next period of time. But be kind to yourself, pick one or two and explore over the next 6 months, and maybe revisit this screenshot again to do it again in 6 months. It can help to have a mentor. So if you have a mentor you want to touch base with about developing these skills, I would suggest you do that, or even just amongst yourselves. Amongst your peers is a really good way to sort of keep yourself accountable, but also express what you learn, because when you express what you learn, that's how you kind of know that you really know it. All right, and I leave it there.
That was fantastic, Michelle.
Oh, really?
Just start. There we go. I couldn't see myself for a second. And I think a lot of those skills that you just listed are fostered in a STEM career in a lot of different sciences. They bring in a lot of those skills, and they're transferable. Nothing in them says, hey, you can't do something else.
No,
like plant physiology.
Exactly.
That was my first question, is why the plant pathology in the summer?
Yeah, I didn't elaborate actually why. So it was a visa thing. So with the visa that you have when you study in the States, you can't work for anything but the university. So it was either, there was lots of jobs in the cafeteria, which I didn't really fancy doing, especially during the summer, because I thought it'd be quiet. And then there was no jobs in kinesiology, and I just saw this one online. And to be honest, I did the interview, and that was my first interview I'd ever done, and I really sucked. I was like, oh man, that was bad. And next thing, the professor came out in the corridor, goes, "Who's that in the corridor with a funny accent?" And I was like, what? So honestly, and he brought me into the office, and I swear the woman who was interviewing me wouldn't have given me the job, only he did give me the job. And I think he gave it to me because I grew up on a farm. That's why. So yeah, as I say, you never know the small stuff.
Any skills you can draw on.
yeah, exactly. And as I say, that was one of definitely the highlights of my time there. He actually came to our wedding in 2018, and has been at the house stayed. So it was really, really good experience.
Fantastic. So you've kind of gone to a lot of different countries. I had kind of no idea that there's been a little bit of bouncing around. Is it difficult when you end up in a new country to kind of restart each time? You're probably quite a pro at it now.
No, it's a great question, and I'm not going to lie. Yes, I did, and for whatever reason, I found it harder here in Melbourne. I found Iowa was a bit easier, and I don't really know why. Maybe it was the fact that I didn't have classes to be integrated in, whereas you did have classes in Iowa. But it's always challenging when you go somewhere new. Even when I went to Dublin for the first time, I was terrified. Like, I was terrified. But yeah, it is challenging, but you never regret doing it. You never regret going anywhere or embracing it. You don't.
It's all part of, once again, those skills and experience you learn how to start the new city.
Yeah, you do. And you know, the best thing is just to throw yourself into things. Get I would say, find do what you like. If you like yoga, well, that's, I guess, you get into yoga when you're a bit older. I think most when you start a running club or a hockey club or something where you're doing lots of social. Or netball is great one here. My cousin came out a couple of years ago, and she's about 5 years younger than me, so we tossed her into net club or netball, and that's where she's met a bunch of friends, and she's So it's
people you don't work with. I'm all for that.
yeah, exactly.
I had a little quick question that's kind of related to your research, and you talked about what you're writing for and the audiences that you're writing for. You've got academics and clinicians and patients. Do you have a lot of contact with clinicians and patients in the work you do, or predominantly into academia?
Yeah, really good question. And this is something I'm really trying to improve on. I would say 12 months ago, most of it was academics and some clinicians, because where I'm based in the Centre of Health, Exercise, Sports Medicine, there are actually a lot of physios, podiatrists, and medicos. So that sort of keeps that balance with the clinicians. But it's quite different working with clinicians we have clinicians in private practice delivering our interventions, and we touch base with those guys every 3 to 4 months. But they've got such a pragmatic, we think textbook, where they think practical, and that's why it's been invaluable speaking to them. But more and more research wise, I realize how important it is to talk to patients. Like I love getting the participants into the lab and having a chat with them about how they found things, but actually being more intentional about involving them earlier in the research. It is becoming more fashionable here in some I say that loosely because there are other countries that do it really, really very well. I have to say the UK is really, really impressive in their guidelines and the frameworks and how they do that. But it is really important. It is really important to hear from the people who you do it for regularly.
Yeah, and I think that's what's great about kind of medical sciences is that there is a person who's the end game who you can talk to. Obviously, in the eco and things, you see animals, but you can say, yeah, it still hurts. It's
Yeah. Yeah. What do you ask me to do that for? It still hurts.
Did nothing. Do you think your love of sports when you were young helped you kind of get towards this thing and see you?
Yeah, I never really physio itself as a profession never really piqued my interest. I was really always interested in sports and how do people become as quick as they do or as strong as they are. But then I kind of realized how you can use exercise to treat a lot of different conditions. And I think, physio is an amazing profession and they really do help profoundly patients, get through injuries and live better quality of life. But I'm really interested in the science behind the exercise. What is the science behind why something works and why it doesn't work? And can we sort of target why and who does this work better for, if that makes sense? Because we know not if people have been to a physio, they know that it doesn't work all the time, or they wear the brace, his sore knee, it doesn't work all the time, and we don't really know how and why these things work. So that's really where I find the link between exercise, my background, to what I do now.
Exercise as medicine doesn't sound great.
Yeah, it sounds painful, right? But it really is. It's regular exercise prevents against 35 chronic conditions. But we don't know enough about why or how it is. If we did, we'd probably put in a pill, to be honest.
I say that's the best pill you can buy. 35 conditions is great.
Yeah.
You also touched a little bit on braces, and that's not the teeth braces; it's leg braces, isn't it?
Sorry, yes.
Yeah. And so how you form your physio stuff with the biomechanics side of it is it drawing on new skills? Is it did you have to look a lot different stuff to get involved in the kind of braces work? Or
yeah, no, it's a great question. So when I went to America, I didn't really work so much with the physios. I was actually based a lot with the engineers. My supervisor was an engineer. So I had that biomechanics training, if you like, with 3D motion capture. And we kind of looked at biomechanics and how it would progress, because we kind of think osteoarthritis is mechanically driven disease. So that's how I had the biomechanics come into it. And then patient or physios, can recommend fit braces for their patients as well. So that was that link in between. And we ended up getting a young guy called Scott Starkey. He's just finishing off his PhD now. So he was involved in that study, evaluating how the braces worked in his background. So he found that interesting, from a physio point of view, how things are working, because they don't know who to say, oh, can you get this $1,000 brace? They don't really have good feel for, who they should recommend. Can you get these shoes? Can you get these things? So if they had a better understanding of those things, I think it would help their practice as well. And they know that.
All need each other. I like this.
Yeah.
This collaboration framework, because you do see people kind of walking with them and you wonder, how do you say this person it's going to work for and this one it might not?
Yeah. Look, basically in a nutshell, the whole premise of the brace is that it unloads, so it releases the pressure in the inside of the knee. So that's essentially how it proposes to work. We can't flush that out in data yet, but that's the theory.
Okay.
Yeah, we're working on it.
So how much kind of work on computers and data analysis do you do as people would say in the field? They're thinking about you're outside doing things or working with people. Is it a significant chunk that's that computer data analysis of things?
Yeah, it sort of shifted a little bit over time. And I think when you start out early in your career, you do more hands-on with patients in the lab. And that honestly is super fun, because you can especially someone who's not a clinician, right? So that was my contact with the real people who I was doing this for. And I really, really enjoyed that. You kind of do less of it as you sort of, the more your career progresses, because what you're expected to do is sort of focus more of your time on creating those big ideas and how to test those big ideas. And then when you write the grants, you write it in, I'm going to get somebody to, that's how you hire people to do those more face-to-face contact with patients. So unfortunately, I would say not as much as I'd like to, especially over the last 24 months or so.
Yeah, we've kind of been prevented on the face-to-face front.
Yeah, so it's sort of shifted a lot of things online.
Yeah, and the telehealth has kind of come up, but it's not the same.
Yeah, they're actually doing a really interesting study at the minute at some of my colleagues in the centre. So they're looking at to see whether the outcomes are the same whether you delivered the intervention in person versus online telehealth like this. So because we know exercise sort of works for most people, but we don't know whether there's a difference in how it works for two different modes of delivery, if you like. And I think it's probably got big implications for countries as expansive as Australia, where it's not that feasible for a lot of people to get to clinics. And it's probably, I don't know, personally, I think it's more of a hybrid scenario rather than all or none.
Yeah, I think we're probably all finding that out.
Yeah.
So you listed a whole lot of jobs, and that was kind of a little bit mind-blowing that, plus 58 million jobs, we're going to lose some, but we're going to gain so many more. What are you seeing would be the future in your research area? Where is it going to go? What will your daughter be researching?
Yeah. Gosh, Faith, she'd smash the computer right now. She does try and get in there and help me some days, but it doesn't always go well. I honestly think like artificial intelligence and machine learning. So because we're in our world now, we have so much data, we have so much information, and I think there's so many clues in that information that if we only knew how to look at it and train and to see things and integrate it in a way, I think we will learn an awful lot of clues to push the boundaries of knowledge.
I think you can have the robotics that be our arms and legs for us. Still need to do the exercise.
You still need the exercise, but like it's like I was watching a documentary, and like with the robotics, like they're making it in a way that people can feel like the touch and the sensation in the like it blows your mind. It blows your mind.
Yeah, it's all out there ready to be discovered, I think, and it's everything. We're gonna have to deal with computers, which is scary thought for me.
I think you're doing well. You're doing well.
Well, I just wanted to thank you so much for joining us today and sharing your fabulous journey all the way from Ireland to Melbourne and all the way along the way, and everything that you've done is just mind-blowing is going on here. And for all of our guys watching, I'm sure you can find Michelle if you have more burning questions. You should also have received a worksheet from us, which is a little bit of expansion on her work and on the series and career roles. If you haven't got that, get in touch with the stellar.admin@atsi.org.au. When we close this, you'll be sent a survey, so definitely give us some feedback. And I wanted to also let you know we've got another talk coming up on Thursday this week, which is Rosalind Hickson is coming up, and we've got 2 more in the next couple of weeks. So jump on the STELR website, register for all of those, and also you'll see our next set of ones for next year. It'll be here before we know it. Thank you so much, Michelle. And we want to also thank the Victorian Challenge and Enrichment Series, who has helped support this series of talks for us here. And I hope you'll have a fantastic afternoon.
Yeah.